Now the beautiful thing is coming. This has been published by GMC 2-3 days ago. You are wrong. Workforce strategy, facing and fact and shaping the future. Whatever document you published in July, you have to put it in the bin. It's not working, it's not going to work. They put all these information, it's a summary. Please go and have a look, it's very worth reading this document. Supply of new doctors in the UK workforce, not maintaining our demand. The second one is, we are totally dependent on non-UK doctors. It's increasing day by day. UK is at risk becoming less attractive. It's not becoming already. And the strain on the training grade doctors, more. This has been published by GMC. The Nursing College has published a similar kind of document. They deny that. Your workforce strategy is completely out of order. I don't say this, any of these words, because I have used the words very correctly, because these are evidence-based. Right. Our locum situation, somebody will talk about, we can get some locum doctors. Remember, 50% of the locum doctors number has gone down. Now, this is one of the things. 65, according to the GMC, in September 2018, 65% of the doctors might leave the UK. That is, the number is very big. You can see that 13,200 doctors might leave the UK by next year. What are we going to do? Not only that, you know the visa setup, that's breaking our bond. So, we mentioned this many times. We did that another presentation last year, and before that also we mentioned that we are going to face a double-dip middle grade doctors crisis by 2019. Don't worry, we are a little bit safe because of Professor Subedi developed this CSER program and all. It's okay. Right? Hang on. This is simply our goal. We have to improve our quality of care of the patient. We have to make sure we are providing the service which is value for the money, because we are using the public money. That is our simple goal. First question is, current staffing level in our hospital and nationally, is it safe? This one from our CQC report of Doncaster Royal. It's not safe, it has been mentioned. DBTH's medical claim and litigation cost for last 5 years, 5.5 million. Sometimes we talk about 10 pounds. It's coming, it's better, it's getting better, but still. NHS medical negligence claim, 12 million all over the country. Sorry, 12 billions nationally. At the moment there are cases going on. Total case, if they win, NHS has to pay 52 billion to the claims. So, total budget, I would like to remind, 126 billion. NHS negligence claim likely to be doubled by 2023 according to the Medical Protection Society, because we are not safe. Second question, current staffing level, is it efficient or value for the money? Next question. Urgent and emergency care, locum agency cost across the South Yorkshire and Bassetlaw Trust, 11.9 million by 2016 and 2017. National urgent and emergency care, total cost is 3 billion. Only urgent care, sorry, I'll rephrase that. Urgent and emergency care, locum agency cost 1 billion pounds. All the locum agency cost is 3 billion pounds. See that how much money we are wasting. So we need a clear strategy. This is our hospital service review. This will continue for another 5 years. Somebody has recognized that. Thank you for that. Now I'm going to tell you what is our strategy, how can we approach it differently. We developed this, we were talking about number of years, but anyway, we formed this QMED center in Doncaster. Basically, this is our intellectual property. We are 3 people, Prakash and myself, and we need academic support as well. We developed this project. This is our vision. By 2022, our QMED center will be every single country. We are targeting 10 different countries, developing countries. So every country, for example, if you take Nepal, other hospital will be connected to the national center. The same way in the UK, our Doncaster Royal will be the national center that will be connected. So this is our the vision in the future. According to this, ourselves and the Doncaster Royal, this is our current situation. We exchange our rings, we proposed each other, but we are not married yet. We are planning to get married very soon. Okay? So the QMED and the Doncaster Royal. This is our vision. This is our concept. There are 2 things. One is a brain circulation. Next one is brain share. The first one, brain circulation, means we select the doctors, we start the training from there, we move the doctor to our workplace, we train them for 2 years or whatever the number of years we need, but maximum 2 years. Then we move the doctor back to their country, complete their training, let them work, let them give the service for their country. That's our concept. The second one, brain share. In this process, we train and we use our consultant and their consultant. We use our workplace and their workplace. We share everything, including the funding. That's our brain share. This is our concept. So we have a 3-layer project. It's like this cake. The middle one, already we developed the program called Hybrid International Emergency Medicine Training. The second one, we are in the process of developing a senior postgraduate level training called Hybrid Fellowship in Emergency Medicine Training. The third one is introductory program we call as a BEAM, and there is another training. I'll briefly tell you. But we can't forget the nurses. We keep them on the top. We are already starting that process. They are like an icing on this cake. So we need them as well. We are giving some support for them. The HEAM training program, this is the first hybrid international emergency medicine training, which is a collaborated program between developing countries and ourselves. It's a hybrid, this is not an emergency training program, this has been collaborated with the leadership and management. It's an earn, learn, return program. Total 4 years training. There is no disadvantage for CCT trainees. This will save around £800,000 per year from only 4 trainees. If you increase the number of trainees, that will be more. This is how from the business case I put that. This will bring a permanent, stable, sustainable solution. I'm not going to go through in very detail. So, first year they will start the training in Nepal, and second year they will move to, second and third year they will move to Doncaster, and they will return to their country later on. The number of components they will go through, and at the end of the training they will get 2 different qualifications, MR Camp and the Fellowship in Quality Improvement. This training already, we received this message a couple of days ago, already has been recognized, internationally recognized training program or by the Royal College of Emergency Medicine. This has been accepted. Now, the second training we are talking about, there are some doctors, they already finished the postgraduate in their country. For example, GP in emergency medicine. Those doctors are 10 years experience. So we're going to select them, we're going to give some more training here, and we will send them back. So we will get the benefit and they will get the benefit. Already this Nepal Medical Council has published this advertisement, that's why I wanted to put that. We are collaborating with the medical memorandum of understanding between the Nepal Medical Council and ourselves, QMEX, and the Ministry of Health of Nepal as well. We are working together as a team. So this is the second. The third one is, we are thinking about, this is another dream, but anyway, this will come up very soon. Now, most of the countries, they don't have emergency medicine training. So we have to introduce them. So what we're going to do, we're going to develop a small program, and we're going to tell them, this is how the emergency medicine training will be there. This is how the emergency medicine practice will be there. We can attract the nurses, we can attract the junior doctors, and the medical students as well. So we're going to put the seed, maybe another 10 years time, that will come very nicely. So we have to start very good strategic program, not like our NHS and improvement, whatever the strategy they are talking about. Right. I would like to share a few photographs with the Doncaster Royal, our team. So now this is one of the medical school, medical college and teaching hospital. These are the 4 organizations we are collaborating. And now we have been there for 4 different reasons. First one is we wanted to recruit the trainees and exams and entrance exams. And second thing is Dr. Ballesteros with his help. And we wanted to give some training, ultrasound training for those trainees. We wanted to leave something behind. So thank you so much. He did an extremely very good job. And he became like a hero there. And the third one is basically the conference. First emergency medicine conference in that country. So we collaborated and we did that. He was leading that. Every element, there was one person from our side, one person from their country. So he was, again, the trauma conference was leading by Dr. Ballesteros. We did an extremely well conference. You can see that, how successful is that. He is a man from other country, the Nepal. He's the chairman of this medical school, and he's a key person to make this success as well. So he's Professor Harry Nipan, so I want to mention him as well here. Now, few other photographs. This is the exchange of our memorandum of understanding. Behalf of Doncaster Royal, Dr. Ballesters was exchanging this document. And Dr. Subedi was exchanging behalf of the QMET, and he was exchanging from behalf of the Nepal. And unfortunately, another colleague behind him, and she is here. She is from the Leadership and Management IAML. Few other photographs, we can see that. This is what I am talking about. He is a hero. Right now, I can go through. Not only that, we did not stop there. We were meeting the Ministry of Health and the Nepal Medical Council. We already started the communication with them to bring a few nurses as well. The nurses' point of view is slightly different. Nepal producing the number of nurses, 50% of the nurses are enough for them to run their country. Rest of the nurses they are producing for the financial purpose. So we can bring them here. So we have to create a program for that. At the moment, as I said, we did not marry yet. We are in the process of marrying the Doncaster Royals, and after that, that will be possible very soon. And also, we met the father of emergency medicine of Nepal, and he's a teacher of Dr. Subedi as well. So now, our vision is this. Only a couple of slides now. Our vision is this. By 2020, we will be able to bring our middle grade shortage by 0. That's our target. And we have to increase the number of consultants by using the fund, shifting the fund. We are not going to ask any fund, extra fund. We are going to shift the fund. We don't want to waste the money on the locum doctors. We're going to use the fund. We're going to increase the number of consultants. In this team, I'm thinking acute medicine consultant also will be considered. They are doing, acute medicine patients are very high number, so we're going to include that as well. So I'm not going to go through in detail. The other one is, we're going to make it as a financial benefit as well, because we can help the neighboring hospital through the integrated care system. That is our another vision. The next year, there will be a conference. The theme, you can see that acute medical emergency. I can see the consultants, the acute medicine consultants are there. If you are happy to help us, you can come to our conference. Because this year, the theme was trauma. That's why he was leading. Maybe next year, the acute medicine. So that will be a fantastic conference that already the date has been set. Summary. Our systematic innovative brain share and brain circulation approach to supporting international trained doctors will bring benefit to our emergency department and their home nations. Improve the quality care of the patients and the value for the money. That is our goal. We believe we can reach that goal with these programs. Reduce the brain drain and brain waste from low-income countries, which is very important. We have to share the brain and we have to circulate the things. Thank you. If you have any questions, please ask.
Thank you, Naushad. Any questions from Ambassador and next, please?